Heart to Heart on ABC 27 is brought to you by Penn State Milton S. Hershey Medical Center.
There's a woman in Reading who celebrates life every day. Why? Because she knows how quickly it can be taken away.
Arlene Rodriguez is an amazing artist. Her talent became apparent in junior high school.
Something I love to do. I used to do it for free. My family's like, you can sell it. No, I do it for free. But I just love doing it, just for the love of painting.
Portraits are her forte.
I painted my daughter and my brother. It should be Marilyn Monroe, but I don't copy too. Sometimes I just use them as models.
A real love that comes from her heart, but her heart couldn't keep up. Arlene's children knew something was very wrong.
She wouldn't be able to even stand up without being out of breath and her heart racing.
She was really bad. She couldn't walk up a flight of stairs.
They diagnosed me with heart failure, and I stopped painting little by little until I stopped painting completely because my health got worse and worse.
Arlene was transferred from a hospital in Reading to Penn State Milton S. Hershey Medical Center.
When she got here, she was basically in borderline shock. It became clear after a number of diagnostic tests that she really suffered from end-stage dilated cardiomyopathy, where the heart had gotten very, very large and ineffective at pumping blood. The blood flow was inadequate to keep her vital organs alive.
My brothers and sisters came from all different states, and we weren't sure what was going to happen.
Doctors told Arlene's children a heart transplant was the only way to save their mother. While Arlene waits for a donor heart, doctors attached this small device to her heart. It's called a heart-wear pump.
This pump is going to suck the blood from the left ventricle of the patient, which is the weak part of the heart, accelerating the blood in the pump and pushing the blood again to the main artery.
It's doing the work of my heart. It's pumping blood evenly throughout my whole body, and it's letting my heart rest.
Just we put the pump on her, the organs started to recover, and the patient started to recover as well.
Until Arlene receives a donor heart, she returns to Hershey Med once a month.
What things are you able to do at home?
I'm able to go to the mailbox now, able to get my medicine.
Dr. Ali Banayosi wants to make sure Arlene feels good. He also wants to make sure the heart-wear pump is working properly.
We reviewed your medication, everything is okay, we're not going to change anything. Okay. Everything's fine.
So far, so good.
Hey, what are you doing?
Now Arlene and her family wait for that very important phone call. In the meantime, they make the most of each and every day.
Even now, we know every day is a blessing.
For every day that I even get to talk to her, see her, I don't know what I would do. I wasn't able to, so.
I'm lucky to be alive. I'm happy to be alive. I can see my grandkids, and I'm trying to get back into painting. I'm little by little, I am.
And tonight, Arlene is doing well, and she is waiting for a heart transplant. Chuck?
Thank you, Deborah. Now joining us in the studio, Dr. Anik Halsey, a cardiologist at the Hershey Med Center. And Doctor, we have a picture. We're going to be showing this picture comparing the size of the heart-wear pump to an older pump, and then a picture of it next to a nickel. Now, I got to ask, how does this smaller pump make a difference? How does that benefit the patient?
Well, this pump is obviously easier to implant, and therefore it reduces the amount of complications after the surgery, like bleeding or infection. And second, well, this pump now being so small, it makes it available for smaller patients, such as women or younger patients. So that's a big difference, yeah.
How long has this pump been around? Is it fairly new?
Well, it's been around for a couple of years only. Well, the first trial was made, it was an international trial, and the device has been available for a year now in Europe. And now a trial has started in the United States, and the American trial is going to be large and include as many as 150 patients throughout the country. And Penn State Hershey Medical Center is the only center in Central State in Mid-State to participate in this study. So we hope the FDA will approve the device like over the next 2 years or something like that.
Well, now it's good to have all these devices we show on the show, but what can women do in general to prevent heart problems?
Well, heart problems and especially cardiovascular disease, we are talking about heart attacks and things like that, well, are easy to prevent if we are careful about, watching our diet, exercise, taking really good habits and quitting smoking. So that kind of thing really helps and is really effective in prevention.
Actually, when you see that list, there's no surprises on that about taking care of your health. Thank you, Doctor, for joining us here tonight.
Thank you.
And let's check back in now with Deborah in the ABC 27 call center. Deborah, what's happening there?
Well, Chuck, we do have a few viewer questions that have asked about this. Here it is. From both of my parents' families, there's a history of heart problems. Is there a test my doctor can give me to determine if my arteries are clogged or if I'm at risk for a heart attack?
Well, one good test would be a fasting cholesterol panel, and you can talk to your doctor about what other risk factors you may have for a heart disease, and they might need to get a stress test depending on your symptoms.
Okay, thanks so much, Doctor. And we will be right back.